Good morning and welcome to Fox 29 News Now on this Monday morning. It is January the 7th around 11:40 a.m. I want to first take you over to the Wolf administration where they are providing an update on the progress made in the first term to fight the opioid epidemic.
The front lines, from educators, law enforcement officers, judges, coroners, researchers, and community workers. We've been visited by the federal government to share what we are doing and describe what resources we need to keep our progress going. Even earlier today, we were visited by representatives of the state of West Virginia who want to use the command center model that we developed to combat the crisis there. There's still a tremendous amount of work to be done. We collectively are dedicated to helping Pennsylvanians and saving lives. I'd like to introduce Lynn Kovich, Deputy Secretary for Mental Health and Substance Abuse Services at the Department of Human Services, to speak more about treatment efforts. Lynn?
Thank you, Ray. Good morning, everyone. First of all, I would just like to acknowledge Secretary Miller, who wasn't able to join us today, and I'm really here speaking on her behalf. So I just want to provide a few of the updates in terms of what the Department of Human Services has been doing as part of this really great group that has been assembled to deal with this crisis. So really since 2015, and even really before that, the department has worked to ensure that we're coordinating things across all of our program offices to combat the crisis. Probably the biggest thing that the department has done, as Dr. Levine mentioned, we created what are called Centers of Excellence. There are 45 Centers of Excellence across the Commonwealth representing 29 different counties. And they were established really to do three things: to better integrate physical and behavioral health care and really focus on whole person care, to utilize community-based care, treatment, and resources to keep people engaged in treatment, as well as expanding access to evidence-based medication-assisted treatments really across the span. So the centers officially began operating in 2017, and since then have served more than 12,000 people, now 12,000 additional people receiving treatment through the Centers of Excellence. Before they were established, only about 48% of people who had an opioid use disorder, as well as being a Medicaid recipient, were receiving treatment for OUD. And of that 48%, only about a third of those individuals stayed engaged in treatment for more than 30 days. So you can see the results were not very good. Now, today, as I stand here before you, more than 70% of people are accessing treatment, and more than 60% are staying in treatment longer than 30 days. So the department will continue to work closely with our Centers of Excellence as things change and things evolve, as you all know. We're also working with our hospitals across the Commonwealth for folks who present at the emergency room, and how the hospitals can provide more appropriate follow-up after 7 days of discharge. So we've been working with the hospitals to really improve their services by prescribing buprenorphine prior to discharge, and then providing that warm handoff that you will hear more about as we go through the rest of this event. But the warm handoff then can really have somebody be handed off right into either a medication-assisted program, facilitate an inpatient, direct admission to an inpatient facility to either do methadone observation or buprenorphine induction, as well as developing protocols to work with women who are pregnant and also have an OUD. Participation in the program right now in terms of on the part of the hospitals is voluntary, but we're monitoring this very closely and monitoring performance and monitoring the outcomes as part of this. We're also working with our partners at the county level in both the child welfare system as well as the early learning sector to provide support and families to children, to provide support to children and families who are affected by the crisis. Unfortunately, this is something that affects kids as well as families. So the administration really tried to increase the commitment to evidence-based home visiting programs. If you've heard the Secretary Miller speak, she will usually talk about the home visiting program. She is a big fan of those. And the administration is, in this year's budget, 2018-2019, providing an additional $4 million to increase the programs for 650 families in most of the hardest hit areas by the epidemic. So the service will provide access to parenting groups, parenting classes, peer support specialists, and having folks available for the families to access the treatment and the services that they need. Another really big initiative that we're doing in collaboration with the Department of Health and our DDAP, Department of Drug and Alcohol Programs, is has been formed a multidisciplinary work group to address the needs of substance-exposed infants, and you'll hear more about that as well. And the main purpose of the group is to draft safe plans of care for the infants. And so in the spring, the group will begin training the county teams at the county level to begin to implement the plans. We're also working very closely again with DDAP on something that is called the DART, the Drug and Alcohol Referral Tool, which is really the DART is a centralized place for people to come to help find services. It can be very daunting for a family or even for someone willing to accept services to find treatment. Sometimes the system can be a little confusing for families and loved ones and for individuals seeking treatment. So the DART is a centralized way to help people access treatment. And we're really hoping that this is a first step in someone's recovery, is being able to have that one place to go to find the services and the treatment that they need. So that is just a few highlights of some of the work that the department is doing. And now I'd like to introduce my colleague, Danny McIntyre, from our Department of Corrections.
Thank you, Lynn. Good morning, everyone. Department of Corrections is proud to be part of this command center. And I'll tell you one thing, MATs, or medication-assisted treatment, we started with Vivitrol in 2014 with the support of Secretary Wetzel, who's very big with MATs, and the support of Governor Wolf. With the initial intake of Vivitrol in 2014, we expanded and hired a full-time coordinator for the MAT process. And that was in 2016. Since then, we've expanded Vivitrol to all of our facilities, 25 SCIs across the state. We have participation up to 2,000 reentrants currently involved with the Vivitrol project. From there, we've expanded. We are now piloting buprenorphine at SCI Muncie. This is a program that specifically is used in Sublocade. It's the first injectable use of buprenorphine approved by the FDA. We're looking at approximately 20 people per month utilizing this. And Secretary Wetzel is very supportive of the MAT usage and the expansion of this product. We're very excited about this moving forward. Some of the other instances that we've expanded upon with Department of Corrections specifically was the use of body scanners. Body scanners have been utilized to start out with at Warnersville Community Corrections Center. We had double-digit overdoses in the past couple of years, 2016, 2017, where we were counting them. We had double digits. We had 2 deaths. So we were really looking at some sort of solutions to help out with our centers. So with the support of Secretary Wetzel and, again, Governor Wolf, we were able to purchase and utilize a pilot program of a body scanner at Warnersville. Since that time, we implemented that in January of 2018 with the support of this whole command center. We've had zero overdoses, 0 uses of Narcan, naloxone at our center at Warnersville. We're very proud of that. They've done an outstanding job. But to expand upon that, we decided, you know what, it's done such a great job of keeping contraband out of our centers. Why don't we look at the SCIs as well? So we did a pilot program at SCI Cole using body scanners, and it's reduced the amount of contraband. It's had a huge impact on the population there. It's had a positive impact. We all know about the issues that have been facing the Department of Corrections the past several months. This initiative is going to go statewide with the support, again, of the administration. We're putting body scanners in every one of our SCIs across the state, 25, and the Coahana Boot Camp is one of them. We're also putting some additional ones in our centers that we've had issues with, where this opioid overdose impact is creating havoc for everyone, not just at our centers, but everyone across the state. So the Department of Corrections is very involved. We appreciate the support of everybody up here. It's been an awesome experience for myself to be part of this. So thank you very much. And next is Lindsay Vaughn from PCCD.
Thanks, Danny. Good morning. As Danny mentioned, I'm here representing the Pennsylvania Commission on Crime and Delinquency, which is the state agency responsible for policy making and planning for criminal and juvenile justice. And we're proud to sit weekly with our state partners as we battle the opioid epidemic. PCCD primarily fights the opioid epidemic in three ways. First, we provide funding for local counties and municipalities to provide community-based intervention programs. We do that through multiple federal and state funding streams, and some examples of programs that we fund would include problem-solving courts, some of which are opioid-specific, community educational forums meant to remove stigma, and programs tailored for both adult and juvenile populations and prevention. Additionally, we support county overdose coalitions through our support of the University of Pittsburgh's School of Pharmacy Program Evaluation and Research Unit. They've worked with 48 counties to develop 39 comprehensive strategic plans to attack the opioid epidemic from the local level, and have implemented more than 200 community-based programs with the support of their technical assistance. Many of those counties that have worked with Pitt Peru have shown a reduction in overdoses in the past year. Finally, we administer the naloxone for first responders program, which was made possible by a $5 million appropriation in the 17-18 budget. Through that program, we provided more than 41,000 doses of naloxone to first responders throughout the Commonwealth. We defined first responder very broadly so that we could get naloxone into the hands of those folks who are most likely to come in contact with someone in a state of overdose. And it provided naloxone to more than 1,300 first responder agencies since November of 2017. Thanks to the work of these first responders, just through this program alone, there have been more than 4,500 overdose reversals throughout the Commonwealth. We were also proud to participate in the Naloxone Day effort that Dr. Levine mentioned in December in the planning and able to provide resources for naloxone for that day. And as the Command Center continues to discuss the potential of a future Naloxone Day, we'd certainly be happy to continue to participate in that regard. It's now my pleasure to introduce the Secretary of the Department of Drug and Alcohol Programs, Jennifer Smith.
Good morning, almost afternoon, but still morning, hopefully still morning when I'm done talking. Thank you, Lindsay, and I want to thank everyone standing on this stage and their various colleagues who weren't able to join us today. I'll echo the appreciation of the amount of staff, time, and effort that have gone into these disaster declarations. So I'm Jen Smith, Secretary for the Department of Drug and Alcohol Programs, and at DDAP, our primary focus is to coordinate and lead the Commonwealth's policy and programming around drug and alcohol prevention, treatment, and quality assurance. So while our efforts to combat the opioid epidemic began well before the establishment of the Governor's Command Center, I can say with absolute confidence that under Governor Wolf's leadership, the disaster declaration has brought forth the necessary departmental collaboration to help support and leverage all of the Commonwealth's resources to combat the epidemic and to help individuals throughout Pennsylvania who so desperately need and deserve our support battling this disease. We've made significant strides to provide access to treatment, to curb the availability of opioids, and to inform individuals about how to access services. For example, in 2016, we required the Commonwealth's single county authorities to establish a warm handoff policy. And when I say warm handoff, I'm referring to a facilitated referral to treatment from the emergency department. Currently, warm handoff programs exist all around the Commonwealth at varying levels of implementation. However, strengthening those policies and processes remains a priority for this administration. In fact, last year, the administration held regional summits to bring together county authorities, hospitals, treatment providers, first responders, and insurers throughout the Commonwealth to help establish those partnerships at the local level. I'm happy to report that 50% of emergency room overdose patients are being directly referred to substance use disorder treatment through this warm handoff. That's more than 2,000 individuals Commonwealth-wide. To continue this momentum, the administration will convene some additional warm handoff summits beginning in March to address implementation roadblocks and continue to foster the partnerships between local and community stakeholders. In addition to helping individuals into treatment and expanding capacity through avenues like the administration's Centers for Excellence and PACMAT programs, we understand that a critical preventative step in combating the opioid crisis is ensuring less unused prescription medications in our homes. Since the inception of Pennsylvania's drug take-back program in 2014, there have been more than 515,000 pounds of prescription medication destroyed, with more than 800 take-back boxes established across all 67 counties. I'm proud to say that we have almost doubled the yearly amount of medication destroyed between 2014 and 2018. I encourage everyone to participate in this small act of anonymously disposing of unused medication to ultimately save a loved one from falling victim to the disease of substance use disorder. To locate a drug take-back box near you, please visit our website at ddap.pa.gov. Another critical area the administration has focused on is how to help individuals with substance use disorder and their loved ones access treatment. In 2016, the administration found a desperate need to establish a formal call center to help manage our 24-hour-a-day, 7-day-a-week, 365-day-a-year Get Help Now helpline at 1-800-662-HELP. Regardless if an individual has insurance, is uninsured, or underinsured, the helpline staff can connect them to the appropriate treatment resources they're seeking. I'm happy to say that since November of 2016, the Get Help Now helpline has received more than 36,700 phone calls, with 45% of those calls resulting in a direct connection to treatment. In addition to the actual phone number, 1-800-662-HELP, there's also a chat feature available on our website, again, ddap.pa.gov. So for individuals who don't feel comfortable speaking with someone over the phone, the same trained professionals that staff the hotline can help navigate treatment options and resources through secure, confidential feature of chat. Since the inception of that chat feature in 2016, more than 1,100 individuals have utilized that option to receive information and seek treatment. Although these numbers are staggering, we know that more than 36,000 Pennsylvanians continue to struggle with substance use disorder. And that's why we've spent about $3 million in federal funds to promote this helpline number, ensuring that all Pennsylvanians can be touched by the messaging. Behind me on the screen, if we have some shorter people, you can see some examples of our current media campaign that will be running through March 10th of 2019. It's our hope that by saturating the media market with both traditional media, for example, television, radio, billboards, as well as non-traditional media such as gas pump toppers, doctor's office waiting rooms, college campuses, movie theater commercials, we can continue to chip away at the stigma associated with this disease, and all Pennsylvanians will realize that this disease does not discriminate. It truly affects us all. Since the launch of this campaign in December, we have seen an uptick in the calls to the helpline and hope that those numbers continue to increase. At this time, we'd like to take just a minute to show an example of one of our current television commercials. I believe we have that queued up.
Recovery starts with a call. Pennsylvania's prescription drug and heroin addiction hotline is staffed by real people who are trained to help. They're there 24 hours a day, 7 days a week. They'll get you or your loved one into treatment, regardless of your access to insurance. If you or someone you know is suffering from addiction, call 1-800-662-HELP.
I'm glad you called. We're going to get you some help.
Paid for with Pennsylvania taxpayer dollars.
Thank you to Commonwealth Media Services for the production of those commercials. As you can see, they are impactful, and our continued hope is that they inspire individuals, both young and old, to make a call to the hotline for help. The last project I'd like to discuss are the innovative projects that the administration has developed as a result of the $108 million in federal funding that Pennsylvania has been awarded to fight this opioid epidemic. Thanks to the command center's collaborative structure, the administration has been able to effectively establish these funding opportunities where Pennsylvanians can best be served. Most recently, October of 2018, we were awarded $55.9 million to further our efforts. The administration is currently reviewing multiple applications and standing up an array of cross-departmental projects associated with that funding stream. And they're all focused on prevention, treatment, recovery, education, and training. This most recent grant, the 55.9, focuses on 3 overarching buckets, if you will. These buckets include housing supports and assistance, criminal justice and law enforcement initiatives with a focus on reentrant supports and prevention, and workforce development. We believe that the innovative projects within this grant will positively impact our efforts to combat this crisis by building capacity to support individuals affected by substance use disorder. We know that each individual seeking treatment is just that, an individual. They have different situations and circumstances that may hinder their recovery. Projects like the Opioid Housing Initiative will provide funding to eligible Commonwealth communities to help individuals maintain stable housing while engaging in treatment interventions. And a loan repayment program for eligible healthcare providers who work in health professional shortage areas and specialize in treating individuals with opioid use disorder. Both of those programs will be launching over the next few weeks. Again, I want to thank you for joining us. I, too, am truly proud of the work and the scope of initiatives that the Wolf administration has embarked on. It's because of this cross-departmental collaboration that we are seeing a decline in opioid-related deaths in many Pennsylvania counties. I'd be remiss if I didn't mention our Get Help Now hotline just one more time. That number is 1-800-662-HELP. If you or a loved one are battling substance use disorder, help is available. The first step is making that call. And at this time, I'd like to bring Dr. Levine back to the podium.
Thank you, Secretary Smith, and really all of the presenters. So we have made great progress in the last year through the disaster declarations and really since the start of the administration in 2015. What we're looking for is actually a vehicle called a Public Health Emergency Declaration, and we continue to work towards that. The opioid epidemic is a public health crisis, and future generations may face other public health crises. The ability to declare a public health emergency ensures that we can mobilize our public health resources for this crisis and for future crises. So we look forward to moving forward, working and planning with the legislature to get a law passed that allows for the declaration of a public health emergency. So in summary, what we really want everyone in Pennsylvania to know, all Pennsylvanians to know, that addiction is a disease. It's a medical condition. It is not a moral failing. Treatment works for this disease. Recovery is possible. And we all have to work together to provide hope to the patients suffering from this disease of addiction, to their families who suffer with them, to our communities and our Commonwealth. And through our Opioid Command Center, that's what we're trying to do. Thank you, and we're open for questions, and all of us can answer questions.
Doctor?
Yes?
The question is, it seems the drug companies are oversupplying this stuff. Is there any way to put pressure on them to cut back on their production to what they believe is the amount to be prescribed in a year, a 6-month period?
Mm-hmm. Well, so we're targeting, there are some efforts to address in terms of pharmaceutical companies, but primarily what we're working on is the concept of opioid stewardship. We're working with the prescribers and the dispensers. So we're working with the physicians, other prescribers such as nurse practitioners, physician's assistants, dentists, etc., and then pharmacists. And that's our concept of opioid stewardship. So we've worked with medical schools, we've worked with continuing medical education, we have prescribing guidelines, we have a program where we actually called academic detailing, where we send people out to physicians' practices to talk to them not about using a specific medicine, but about using less opioid pain medications for acute and for chronic pain. And then we have our prescription drug monitoring program, which has been absolutely instrumental in this effort. And through all of these efforts, we have decreased opioid prescriptions in 2.5 years over 24%. And we have more work to do.
Is there any effort to increase the amount of prescription strength NSAIDs rather than opioids?
Well, there isn't efforts to increase the strength, because the strength is really what's appropriate. But we have worked on actually guidelines for acute pain. We had developed an emergency department guideline a number of years ago. We recently revised that. That's available on our website. And so that emphasizes that there are more and more studies that indicate that for most acute, mild to moderate acute pain, for which people might go to an emergency department or maybe to an acute care center, that actually over-the-counter nonsteroidal pain medications such as acetaminophen, such as aspirin, such as ibuprofen, etc., will work just as well, if not better, than an opioid. And so it's not so much the dose, it's using these over-the-counter medicines instead of an opioid. I don't have. You could go onto our website and we can direct you to the number, but we have decreased the rate of opioid prescriptions over 24% since the beginning of the prescription drug monitoring program.
So does your website say 24% of what number?
Yeah, it has the numbers on the website. Okay. I don't have that in my head.
On the opioid dashboard.
Yeah.
And so the other question is along these lines is if you have a prescription drug monitoring program and you're going around talking to doctors and stuff like that, can the state pass a law or a bill that says you can't put opioids anywhere but in oncology?
So that's why I like to use the term opioid stewardship, because opioids are actually essential medications. So the reason I use the term opioid stewardship is it's parallel to antibiotic stewardship. So as you know, antibiotics are essential medicines and essential for pneumonia and other type of severe bacterial infections. But because of overprescription of antibiotics, we have bacterial resistance. And so all hospitals and health systems have antibiotic stewardship programs. So here's the parallel. Opioids are essential medicines for severe acute and chronic pain. And if you're in a local emergency department and you had a car accident and you had a fractured leg, you will need an opioid. And if you had a major operation this morning in a hospital down the street, then you do need an opioid. And then we have patients with chronic pain, as you've been saying, in terms of cancer pain, end-of-life pain. There's other types of pain, sickle cell pain, etc., that do require opioid pain medications. So we want to work with the medical community, and we are being successful in doing this. And they're very open to our collaboration with them to prescribe these medicines much more carefully and judiciously in a targeted way for acute pain and for chronic pain. The lowest dose possible, the shortest period of time for acute pain, and very targeted for chronic pain, as you're saying, for something like cancer or end of life. And that's why we have those opioid prescribing guidelines, which are produced through our opioid prescribing task force, and then experts from throughout the state, which get together for 1,000 phone calls over the course of 3 or 4 months to write or to revise these prescribing guidelines. And all these guidelines have been taken to the boards of medicine for their affirmation and acceptance. So they do establish a voluntary standard of care. The legislature has passed a couple of initiatives. One was that you cannot prescribe an opioid for more than 7 days from the emergency department. And there are some exceptions to that. And also, you cannot prescribe an opioid for more than 7 days for a pediatric patient. And there are some exceptions for cancer, etc. So really, this effort is very successful in terms of accomplishing what we want to accomplish. It's not done. It's going to continue.
But you're using acute and chronic
So much less than they had in the past. And of course, the prescription drug monitoring program is also a tool for the Department of State and for law enforcement, who do have access, and Department of State and the Attorney General's office, so they have access to the PDMP. And so for the few but still present pill mills, those are being actively investigated and prosecuted by law enforcement, and the Attorney General's office, is actively pursuing those and prosecuting those individuals. So it is also a tool of law enforcement, where we're using it with the medical community as an educational tool.
For the corrections person, please. Anything at SCI, Somerset, or Greensburg special?
Yeah, basically we're going to be implementing a body scanner at both of those facilities. We have no timelines as far as I have. I know that they're working with the company to be able to distribute them. We have to do a training. We have to get DEP clearances done, measure the microsieverts and stuff. So there's a lot of things going on, but 2019 we'll see body scanners in all of our SCIs.
Okay, thank you very much.
You're welcome.
I got one more.
Sure.
And I'm sorry.
That's okay.
Said it, but there was somebody said that the cross-department collaboration is the reason the opioid deaths are declining in Pennsylvania. Are you sure about that, or is there any way to say that it already hit its max and therefore it's not?
To be honest with you, we're really quite confident that the decreases that have been shown on the CDC website, of course, 2018 ended a week ago, so we don't have complete data from the year, but that we feel very strongly that the Opioid Command Center and the initiatives from all of these state agencies in terms of prevention, rescue, and treatment are very much involved with the decrease. Would you like to comment?
Yeah, I'll add to that. To talk, it hasn't just been a state cross-collaboration that has assisted in seeing some of those declines. It's also been county-level collaboration and county and state collaboration. So to give you one example, the Armstrong, Indiana, Clarion area of Pennsylvania, which is towards the western part of the state, they were one of the front runners in implementing the worm handoff process that I was talking about earlier. And they are currently seeing between 80 and 90% success rates, which means between 8 and 9 out of every 10 overdose survivors that report to the emergency room are getting into treatment. And the reason that we know the death numbers are because of these efforts and not just because, the epidemic is waning, is because they're continuing to see about the same number of overdose victims, unique overdose victims reporting to the hospital. But now because they have the warm handoff process in place, they're getting those individuals directly into treatment, and they're seeing less repeat victims showing up at the hospital because of that engagement in treatment.
To 50% of people getting into treatment.
Mm-hmm.
Yeah, that would be at places where that would be of people who are offered warm handoffs.
That's correct.
But warm handoffs are still not available everywhere.
That's accurate.
To what extent are warm handoffs available right now?
From a percentage, it's hard to say because I don't know whether you're talking percentage of hospital emergency rooms that have it in place or percentage of patients who are offered. I would say there are still a handful of counties where they continue to work through some challenges with the hospital or health system in that area. And a lot of it comes down to legal issues and liability challenges in terms of embedding certified recovery specialists in the hospital, which is really kind of the linchpin of that warm handoff process, which is having a person who's in recovery be part of the hospital system and able to be in the emergency department to assist with those discussions and referrals. So there's still some significant amount of work to do, particularly towards the Philadelphia area where we have an abundance of hospitals and emergency departments. It's also the place where those EDs are barraged with overdose patients. So we've got some work going on there in those places that continue continues, but we have seen tremendous success in areas like Armstrong, Indiana Clarion, in Berks County with Tower Health, in Reading has seen great success, Westmoreland County, a handful of other examples that I would be happy to share with you afterwards. But
you're saying only about a handful of counties actually don't, and I realize it's not actually organized by county, it's organized by hospitals.
Correct.
Because I'm looking at it in terms of, like, what parts of the state where if someone's likely to be taken to the hospital, they would be offered a warm handoff. And I mean, a lot of the rural counties maybe only have like one
yes,
hospital.
yes,
But
that's correct.
There's only a few.
So we can share that data with you, Dave, if you'd like. We have more detailed data about where the counties are, which hospitals, which emergency departments. If that would be helpful, we'll make sure to get that connected to you. We don't have it publicly on the website, but if you're interested, my communications director is here, and we'll get you linked up so you can have that information.
Thank you very much.
You're welcome.
One more thing I'd like to clarify regarding that. Again, there was the reference to people at the ER being offered buprenorphine. Again, are you talking about that being like starting people on that? Are some of those situations separate from the warm handoff, or is that where a warm handoff is available?
Lynn, this was an initiative, actually, I think that you were talking about. Yeah, go ahead.
So from a medical perspective, we are working to have more and more emergency medicine physicians to obtain their waiver, get the specific training in buprenorphine and get that waiver so that they can start buprenorphine in the emergency department, so that after someone overdoses, buprenorphine can be dispensed or prescribed. And that would be part of the warm handoff process to get them into treatment the next day, or certainly within a couple of days. And so there is evidence from a number of studies in Yale and other states where if you start someone on buprenorphine in the emergency department, you prevent them from ever withdrawing. And then you can get them right into treatment, and they're much less likely to relapse. Do you want to comment?
I guess the only other thing I would say is the warm handoff could also be to an abstinence-based program. If someone wanted to go for detox and then inpatient rehab, that would also be part of the warm handoff program.
So we're in favor of all forms of treatment. Where we've been putting the resources that Secretary Smith talked about in terms of our grants from the federal government, et cetera, is towards evidence-based, quality medication-assisted treatment programs. And that's the 45 Centers of Excellence as well as the 8 PACMAT programs. And so we want to get people directly from the emergency department into treatment. If they choose abstinence-based or rehab treatment, we can do that. If they choose outpatient MAT, we can do that.
There are a lot of numbers thrown out, and everyone seemed to have it a different number as far as the naloxone, the number of first responders saved. Is there a set number?
Yes.
On the dashboard?
So if you go to our opioid data dashboard, and we can get you that website.
And unfortunately, we lost the feed to that update. But again, that was the Wolf administration providing an update on the progress made in the first term to fight the opioid epidemic. I do want to take you over to court in Massachusetts where we have Kevin Spacey. This was from earlier. Let's try and see if this works. Hold on. Okay, this was inside the court earlier, where a judge ruled that Kevin Spacey must stay away from the young man he's accused of groping in a Massachusetts bar in 2016. The disgraced actor was arraigned on a charge of felony, indecent assault, and battery during a hearing at Nantucket District Court today. This is a look at that from earlier today. Spacey did not enter a plea. The judge set another hearing for March 4th, and Spacey does not have to appear. Spacey says he intends to plead not guilty. His lawyer has also questioned the evidence against him. It's the first criminal case brought against the 59-year-old after a string of sexual misconduct allegations.
Guy with the phone going up. Oh no, you may look like an idiot if you do that after it goes off.
Right.
I am, yes,
I'm
sir.
good.
Michael Giordino? Giordino? Yes. Thank you.
I know. No. I know the feeling. Bailey's got it under control.
That's a declaration.
And I saw him say that I'm not going to be fiddling around.
No, I understand that.
What's he decided to do about the restraining order?
He'll take care of it. I'm not going to worry about it.
Okay,
I think all we're
5
going to do
minutes.
is just make a decision whether we can do that later. Court all rise. The court's back in session. You may be seated.
Hang on just a minute. Folks, I made a statement earlier. It probably bears repeating. While you're all welcome to sit here and observe, no one should interfere or interrupt these proceedings. If you do, you risk being held in contempt, which carries a fine or even incarceration in some cases, or certainly being removed from the courtroom. So by all means, sit and observe, but do not interrupt these proceedings. And with respect to the press, we have the pool cameras up here, and other members of the press, you know, if you have your laptops or your telephones, you can communicate with them in the course of doing your job, but you cannot take pictures or record. Anyone violates these requirements, your phone can be taken from you, and as I said, likewise, you can be held in contempt. So I don't anticipate anybody will act contrary to my instruction, and I hope you won't. And I thank you in advance for your consideration in that regard. So, Madam Clerk, go ahead.
1888 CR 0598, Commonwealth versus Kevin S. Fowler. This is an arraignment, Your Honor.
Thank you. All right.
No record.
Thank you.
Okay, Mr. Fowler, this complaint charges that in the town of Nantucket on July 8th, 2016, did commit indecent assault and battery on person 14 or over.
Sir, if you're charged with another offense while this matter is open, you can be held for 90 days without bail. Mr. DA, request beyond the bail warning, any?
Beyond the bail warning, Your Honor, the Commonwealth is requesting that Mr. Spacey be ordered to stay away and have no contact with the named victim and his family.
All right. Certainly, the court will impose those conditions. Anything additional?
No, Judge.
Okay. All right. No requests in terms of movement or staying within the United States. Anything?
As required by the court, Judge, and as required by the probation department, our only request specifically is the stay away.
Okay. All right. Well, those will be the conditions then. Sir, you'll meet with probation. You'll sign those conditions. You'll be required to stay away and have no contact, direct or indirect, with the alleged victim. All right. I know there was a motion filed by defense. I had occasion to look at it. Mr. DA, have you had occasion to look at it?
We've reviewed them, yes, Judge.
Okay. You want to be heard on the motion, or
briefly, Judge? Sure. Regarding the motions to preserve, we agree that anything that is currently in our custody and control, we have to preserve, we will preserve, and we will turn over in discovery.
Sure.
As it relates to the motion to preserve itself, we're suggesting at this point that the scope that is being requested by counsel is overly broad. It's asking for July 7th and July 8th of 2016, but all the way up to the present. We suggest that based on what's been filed up to the present is overly broad. The affidavits and the motions suggest that Mr. Little and his girlfriend or another individual were texting contemporaneously on the 7th into the 8th. And then it says by providing this other information, we'll likely see that something happened or that he talked about it further. But there's no basis for that information within the motion to preserve. We would suggest that it's a fishing expedition at this point, and that the motion should be narrowed at least to the 7th and 8th of July of 2016.
It's a fair point. Mr. Jackson or Ms. Bolero, I don't know who's going to respond, but feel free.
I'll be happy to respond. Alan Jackson on behalf of Mr. Spacey.
Sure.
Your Honor, I don't believe at this point that we need to talk about the scope. That's something in terms of a subpoena. In other words, what I subpoena or what I serve on those individuals might require a discussion or some litigation about the scope. All I'm asking at this point is that we preserve it. In other words, this is data that we believe is not only potentially exculpatory, but likely exculpatory for Mr. Spacey. I simply don't want to see any of that data deleted, destroyed, even inadvertently, or in other words, in any other way manipulated. I don't think it's a burden at all on the Commonwealth, nor on the two individuals named in the motion, MD and the complaining witness, to simply say, I'm ordering you not to destroy anything, so that Mr. Jackson, Ms. Bolero, the Commonwealth can litigate in front of the court at some point whether or not there is exculpatory information that leads all the way up to today. In other words, all I'm asking for is just to put a bubble around that data so it doesn't get destroyed. I'm not saying I get it yet. I just don't want it destroyed yet.
Further response?
We can only control, Judge, at this point what's in the care, custody, and control of the Commonwealth.
Right.
As far as information that would be contained within the specific service providers of these individual cell phone carriers, well, that's different. We have no control over that, Judge. So we would suggest that as far as the preservation goes, whether it be to the individuals directly or to the providers, that it be limited at this point to the 7th and the 8th until more information can be provided as to why it might likely be exculpatory versus a fishing expedition.
Right. I haven't seen any of the police reports, so I don't know what, except for your affidavit, I don't know what information that you base this request upon. I do think that the 7th and 8th certainly it would be appropriate time span to preserve the evidence, but I understand that even if the motion is allowed, it can be modified down the road and can be tightened up. And so I'm inclined to allow the motion. I don't know that I'm going to do it all the way up until, from the 7th and 8th up. I mean, I may give you maybe 6 months worth of preservation, but I don't know that I'm going to require that everything be preserved. Go ahead.
Well, certainly at this point, that would be satisfactory. 6 months worth of preservation, I think, is better than nothing, and I'm certainly willing to accommodate the Commonwealth and the court's guidance
All right.
on that.
So from was it July 7th?
July 7 and 8 of 2016.
Okay.
And 6 months thereafter.
All right. And 6 months thereafter, the motion will be allowed. At least there'll be a requirement that that the cell phones and I think the cloud-based and then some passwords, et cetera, that all be preserved. As I say, that's subject to further modification one way or the other, depending upon what is discovered during the course of this matter. So,
thank you.
All right. We have a further date, gents and ladies that work.
We haven't discussed one yet.
Can you confer with counsel?
Go ahead.
I think we can come up with a date in just a quick
Go ahead.
second.
Sure. Sir, you can be seated. You don't need to continue to stand. Thank you. Thanks. Actually, you got it. Thanks, boss.
Your Honor, may I consult my cell phone real quick?
Sure.
It's got my calendar on it. I apologize.
Honor, Mr. Jackson is admitted pro hac vice. I am local counsel on the case. Are you going to require my appearance from someone from my office at all proceedings?
Are you in already? I know you came in so that he could enter the pro hac vice, but is
yes,
there?
I do have a notice of appearance on file, and Mr. Jackson was filing one today as well.
So your appearance is already in?
My appearance is in.
Well, we'll leave it there. Thank you.
Counsel.
Yeah.
Can we do it the 4th of March? That's fine. That's okay. Yes. Your Honor, if it pleases the court, counsel and I have discussed informally a date of the 4th of March, which is a Monday. I understand that's most convenient for the court.
Yeah, that's right. That's jury week is in February, so March 4th would probably work. Yeah.
And counsel and I also discussed off the record, and I would ask for the court's guidance on this. He has no objection. The Commonwealth has no objections. Mr. Spacey not making that appearance. I can make that appearance on his behalf, along with Ms. Valero, if need be, without him having to be there on that date.
No, and that's fine. His appearance can be waived. However, he should be, the rule requires that he be available, so he should at least be on the other end of the phone if there's some reason that
Absolutely.
he needs to be contacted.
Absolutely.
But his appearance can be waived.
Okay.
Sure.
Thank you.
And
Thank
can
you.
we schedule that, Your Honor, for 11 a.m. again?
Sure. All set? Anything additional, folks?
I don't think so, Your Honor.
No? All right. Thank you all for your help. I'm going to step off, and then the camera people can break down their equipment, and those connected with the case can depart. Thank you very much.
Okay, this case has been continued to March 4th, 2019 for pretrial hearing at 11 a.m. The defendant's appearance has been waived. Sir, you should report to the probation department before you leave the building in order to sign the conditions of stay away and no contact with the victim and the victim's family. Thank you.
Court stands in recess.
Once again, that was actor Kevin Spacey in court. Like you just heard, the judge who's ordered to stay away from the alleged victim. And there will be another hearing March 4th, 2019, but he does not have to appear. So that's pretty much it for this case, and you can stay tuned later on or check out our website for all the information. Well, 2 people are dead following a triple shooting in Kensington earlier this morning. The bodies of a man and a woman were found inside an SUV on Ontario Street, with the engine running. Police say the shooting happened inside the car, where they also found drugs and syringes. The lone survivor, a 32-year-old woman, was shot in the arm. Police are calling her a person of interest. Check out our website for all the latest details on that. I know our reporter is on it today, so also watch our broadcast at 5. Well, along with the rest of the city, Boathouse Row was lit up Eagles green after an incredible wild-card win against the Bears. Eagles beat the Chicago Bears 16-15 after a nail-biting end to the game, where kicker Cody Parkey, who's a former Eagles kicker, missed a field goal that would have sent them on to the next round of the playoffs. But instead, the defending Super Bowl champions, Eagles, clinched the win, moving them on to face the Saints next week in the divisional round of the playoffs. Go Eagles. Well, the second week of January is when people already start to fall off their New Year's resolutions. So, Fox 29 Good Day, we're calling this week Save Your Resolutions Week. They spoke with Teresa Schenk about a Mediterranean diet that may help you.
Just wait 1 second, because when we have these big segments that we like to do, usually we have a big, pretty graphic that we put together. Well, this time, Mike put together the graphic. Are you back yet?
We just came up with this idea on Friday.
Here it is.
Here it is.
I can't read that.
Can you read it?
Save my resolution.
That's the idea. You know, about this second Monday of the new year. Yeah, to heck with it. Well, watching the Eagles game last night, I think I'll eat a big pizza or whatever. So let's get back on track. All this week, we have 5 different hot diets. So the first one is the hottest in the country, the Mediterranean.
So, joining us is registered dietitian Teresa Schenk. And she's going to show us how, this one's pretty easy, would you say?
Yes, yeah, definitely.
Okay.
So
is this what you do?
it's similar to what I eat, yeah,
okay.
for sure. So the Mediterranean diet is more of a plant-based focused diet. It's all whole foods, so concentrating on healthy fats like olives, olive oil, avocado, lots of fruits, lots of vegetables.
Well, I like the sound of all those things.
Yeah, makes sense.
Yeah.
So give me breakfast, lunch, and dinner and a snack.
Okay, so basically, because this is more of a lifestyle approach to eating, there's no structured plan. So there's no prescriptive plan. So I base these visuals off of what I would eat versus what someone who's trying to lose weight. So if you are trying to lose weight, and I just want to say this to the audience, is that women typically 1,200 to 1,500 calories, and men 1,600 to 1,800. So again, this isn't really representative
per day.
Right, this would be maybe what I would eat if I were following the Mediterranean diet. So we would start with some Greek yogurt, eggs.
With nothing? That's just
no, I mean, I would put that in there, but yeah, so like maybe the berries and then the nuts, and then we would go into more of a plant-based lunch. So there would be no protein from animals here, so it's just a big salad and then maybe a veggie chili.
Can we have dressing? Because I don't see dressing.
Yeah, you can have dressing.
Well, I just want to ask.
What kind? Though?
Yeah, because I can get.
So typically they would just use olive oil or balsamic vinegar on it. So it's really.
Or we can't do them together?
Well, yeah, sure, you can mix it all around. But really, again, this is nothing that really has anything processed. So bottled salad dressings generally wouldn't be used. However, you still can. But you'd want to monitor the added sugar that's then in the salad dressing. Because this is very void of added sugars. Also, red meat isn't allowed on this program. Generally, it's, I mean, it's allowed, but it's just not traditionally consumed.
Okay, Ms. Schenk, that's dinner?
Yes.
It's smaller than the rest of
it. It is
everything else.
because typically your lunch is going to be larger than your dinner while following this whole lifestyle approach.
I've heard in general that's a good idea because you still have time to burn it off throughout the day.
Yep. So that's why this looks a little bit larger, and then this would just be salmon, which fish is consumed a couple times a week, whereas other animal proteins like chicken, eggs, cheese, those are consumed in moderation.
And then a little snacky. They're not opposed to a little bit of cheese in here.
No, they're not. So again, dairy is consumed in moderation.
Okay.
So everything's in moderation.
Yes, nothing is off limits in this plan.
No meat.
So you could still have red meat. It's just it's not generally consumed as frequently. So you'd want to concentrate on leaner proteins like chicken, turkey, fish, salmon.
Okay. What are we doing tomorrow?
Tomorrow we're doing the Flexitarian Diet.
Never heard of it.
That sounds more complicated.
Yeah, it's just a little mixture between vegetarian and then fish and animal protein.
Oh, wait a minute. I'm not like that.
Pretty flexible.
Oh, flexitarian. Makes sense.
There you go. Do we have to touch our toes while we eat?
Sure.
Okay.
We'll have you do that tomorrow.
Lovely.
Thank you, Teresa.
Disneyland raised the cost of some tickets by 25%. Fox 29 Good Day spoke with Fox business analyst Tracy Carrasco.
Stocks rallying on Friday's better-than-expected jobs report and comments from Fed Chairman Jerome Powell about the course of interest rates. The Dow up 746 points, capping another volatile week for investors. Stocks closing higher for the week. Apple strikes a deal with one of its biggest rivals. Apple and Samsung announced a plan to put iTunes on Samsung TVs. The deal follows last week's report of slowing iPhone sales and shows Apple's efforts in becoming a tech and media services company too. Apple recently launched music service on the Amazon Echo. And Disneyland has announced it's raised ticket prices for its theme parks for a second time in less than a year. The move comes ahead of the scheduled opening of a Star Wars theme park expansion this summer. A one-day, one-park ticket is now $104 for low-demand days, with peak demand days costing $149 a ticket. For more, log on to foxbusiness.com. In New York, I'm Tracy Carrasco.
A winter weather advisory will be in effect for multiple counties across New Jersey and the Lehigh Valley from 10 p.m. tonight through 7 a.m. Tuesday. The following counties are affected: Sussex, Warren, Morris, Hunterdon, Somerset, Carbon, Monroe, Berks, Lehigh, Northampton, and Upper Bucks. The high for today is 36 degrees with cloud cover and occasional late rain expected. Temperatures will pick up Tuesday with a high of 51 degrees. You can download the Fox 29 Weather Authority app to keep up with the latest forecast. And that is going to do it for today's Fox 29 News Now. I appreciate you guys watching, and Happy New Year to those of you out there. You can check us out at 5, 6, 10, and 11 in our broadcast, and tune in tomorrow for more.